Welcome back, part 2 of the Conscious Conversation series. My guest is Dr. Patrick Lockwood, although apparently the tables turn when I talk with Patrick, so I might be the guest, I don't know. But we are gonna have a conversation. Our first conversation, if you didn't catch it, was really about conscious recovery, why I started it, what it is sort of philosophically, and how it folds into the behavioral health industry and benefits people in recovery. Today, we're going to talk about the Conscious Recovery Institute, which Patrick and I are partnering in and about to launch. Patrick, why are we starting the Conscious Recovery Institute?
Well, first, thanks for letting me come, I guess, co-host. I don't know what's happening.
Yeah.
But, sincerely, thank you for letting me be part of this, because I think something that's mattered to me a lot in the last, I'd say, 15, almost 20 years is trying to change the industry in a way that people relapse less and struggle less, and there's less recidivism. And, we were talking about this in our last conversation about how hard it is for people to get the care that they need and what are the issues in the industry. And so I think, in full sincerity, the reason you and I got together years ago was because we shared the same vision of what's wrong. And I think we also share a very similar vision of what could be better. And so I think we're starting the Institute with the 100% crystal clear vision of helping the industry change from the inside out. Just like Conscious Recovery is an inside out program, I think you and I are creating the Institute to help change the industry from the inside out, right? So the Conscious Recovery is for the patients and the providers, whereas Conscious Recovery Institute is for the industry.
Yeah, I love the way you frame that.
Yeah.
And I think a natural maybe starting point or next point is to talk about what we see as the key pain points in the industry. I mean, part of that is just sort of like basic business, like what are the pain points and how do we offer a solution? I know it goes much deeper for us, and this has been a conversation we've been in for 5 years, right? So we started this conversation sometime in 2021, and it became a series of coffees where we would talk about like what we see happening in the industry. And when we say the industry, we mean behavioral health as a whole, addiction treatment, mental health treatment, and how we see that it's doing some amazing things, and also there's some blind spots. And so let's start with the pain points. I know we've identified kind of the 3 big pain points, but what are the pain points that you see in the field?
I think, first and foremost in my mind is just, staff turnover is probably one of the biggest things. I currently work as a consultant helping with that problem. And so what you and I are trying to do with the Institute is create trainings and services that actually directly address staff turnover so that businesses aren't spending thousands of dollars retraining people and rehiring people and Indeed ads and all this garbage, right? Which leads into another pain point, which is just staff burnout.
Yeah.
I was looking earlier today because I wanted to see if there were any updated stats, as is my want. And, there are something like 8 million healthcare providers in the United States across doctors, nurses, therapists, counselors, etc. 8 million providers. But something like 60% of them are burnt out at any given time.
Yeah.
So there's millions of people that are trying to save your life, essentially, that can't even take care of themselves. That's absurd. The people that need the most help are getting the least help.
Yeah. And so the passion that we have through the conscious recovery lens, again, I say again because I often say it really can be distilled down to something quite simple. And that is, I'm going to put it in the I. When I have felt burnt out, it is when I believed that I needed to be the expert and I needed this client to get something or to do something. Now, I know that may sound overly simplistic.
Sure.
But for me, that's when I have felt burnt out. And then unfortunately, what happens is we say things like, practice self-care, Patrick. What does that even mean? Take an extra day off? If it were just that, this would not be an issue.
Correct.
We would give our employee an extra day off, or maybe we even want to be really generous and send them to a retreat or something, which of course can be useful. But there's something so much deeper, and that is really the philosophical framework of what it means to be a clinician, what it means to be a tech, what it means to be a counselor, a therapist. I could go on and on.
Yeah.
What are we going to provide? And I'm happy to answer this too, but what are we going to provide that is going to be unique and different? And I don't mean in a practical way, because we're going to offer learning experiences that are digital learning experiences, videos, written material that might not be, anything more groundbreaking than someone else, but we are offering something really unique here.
Yeah, I think what you and I are offering is a perspective that most people don't have, which is the emphasis on knowing things, the emphasis on being correct, the emphasis on being an expert, the emphasis on being in control. All of these things come from a profoundly backwards notion of what it means to be a healthcare provider. And I think that that is what is unique about the Institute and what we're offering, because the trainings on paper don't look radically different than other trainings that exist, admittedly. However, the perspective is something that very few people, even in fancy retreats, don't have.
Thank you, because I agree wholeheartedly.
Yeah.
I have discovered something so profoundly simple that it's almost too simple for our very complex industry to absorb, although I know the time is right, because we're not the only ones talking about this now. Whereas 15, 20 years ago, like you, I started in 2008. I think we started in the field at a similar time.
Yeah.
I was kind of in the closet on some of the things that I'm talking about now very openly. And that radical shift gives me information that the industry is ready.
Yeah.
And the profound simplicity of presence, of connection. We talk about clinical attunement, but we don't necessarily go further to say, what is that actually? Is it positive regard? Of course, we say that.
Sure.
But there's something so much deeper, and that is this idea, and we talk about this a lot, that the person sitting in front of me is broken, and my job is to fix them. When I started in the field, I worked at a 48-bed facility, and it was a very nice higher-end treatment program, and I would walk in, and the beautiful gates would open. And I remember I had this thought one day: if I thought there were 48 broken people on the other side of this gate, and my job was to fix them, I could not do this work, and I would be burnt out instantly.
Yeah. One of my favorite experiences as a very new person in the field back at 19 or 20 was very similar to that. I had this, essentially the equivalent of like being a tech or a nurse job. And I worked for the state-funded rehab in central Missouri, which is unfortunately now closed. And we worked with mostly like biker gangs, meth dealers, people like that, and rough around the edges people. Yeah. And this licensed professional counselor, who is the primary therapist of this tiny program, this 10-bed program, always used to say, without skipping a beat, with 100% sincerity, is that the only difference between you and me is the fact that I have the keys. And he always meant it. It was never just like a good, quick, like funny joke to lower people's defenses. He meant it. Because it's not to say that licensed professionals can't be healthier or, further down the path. That's certainly my hope. I hope that
Yes.
all the people that I'm supervising currently as a professional psychologist, I want you to be healthier and doing better, 100%. However, the idea that I am so profoundly different, that the major difference is something in my intellect or my training or my wisdom or my psychological profundity or some shit like that, is completely absurd. I am not drastically different than the patient I'm sitting across from. Now, I have the good fortune of not currently being psychotic or having a flashback due to PTSD, thank God. But the idea that I couldn't easily be there is absurd. I could easily be there. Every person on the planet, even with no genetic risk for psychosis, can do enough meth and become psychotic or whatever it is, right? It's not a big stretch. And that has to disappear. For healthcare to actually do its job, especially behavioral healthcare, we have to just destroy this idea that I am so radically different because I'm a professional, because I have a license. I am magically more healed, more special, more smart in a way that makes me that different than you. We have to destroy that.
Yeah, and the key to this especially with the conscious recovery approach, is that this does not happen verbally.
Correct.
This happens non-verbally, and in my language, this happens energetically.
Yes.
And so if I'm coming into the room, let's say I'm facilitating a group,
Yeah.
and I come in as the expert, the clients feel that. Or I come in as the person controlling the group,
Yeah.
or I come in with even an inkling of superiority, that client's going to pick up on it. I got dragged on social media. I know that's shocking. But the clip was, I said, one thing I know about clients in early recovery is they're highly attuned.
Oh, yeah.
The editor clipped it at that point, and this person, very, very long response. I've worked in the addiction treatment field for 35 years. I think you could not be more wrong. To say our clients are attuned is completely inaccurate. They are checked out. She literally said they are messed up and broken. And it felt like, honestly, someone kind of punched me in the gut, partially because I'm like, yeah, this is who's treating our clients.
Yeah.
And I can't imagine feeling more burnt out than holding that perspective. And the energy of this is what we really are addressing in these so-called trainings. That's why we call them learning experiences.
Sure, yeah.
Because you and I are really exploring some different possibilities. And part of those possibilities are that life is energy. We know 90% of communication is nonverbal, and yet we think it's important what we're going to say.
Yeah, I think how we show up is extremely important because there's the practical reality of what is your role, what is your title. We're never going to escape that. Society is never going to get rid of roles, titles, labels, etc. Those are always going to exist. So you and I imagine, are not being naive and saying your role is going to disappear and we're all going to be perfect and kumbaya. No. What we're saying is your attitude is everything.
Yeah.
And if your attitude is arrogant, if your attitude is I know better, if your attitude is I am so smart that I can magically help you, I am so healed, I have such an amazing perspective, whatever, then that is the problem, right? And the idea that patients, even in the first couple of weeks of being sober, for instance, can't be perceptive is absurd because I think the way that if you go to Rehabistan, as I call it, and you talk to patients 2 weeks detoxing or whatever, yeah, their head's all messed up because they're detoxing and their detox meds and stuff. But the colloquialism you will certainly hear from pretty much most seasoned professionals is these people have the best BS detectors on the planet.
Yeah.
So saying it somewhat differently than you, like, I have never met more perceptive people in my life. Now, is their perception colored by their addiction, their trauma? Of course it is, but they're still hyper aware. Now, that hyper awareness might be bad for them. They might be hyper vigilant, like in PTSD, for instance, but they're aware. And so they're highly attuned to everything that we say and do. Like when I go walk into a rehab as a consultant, I don't walk in there with the attitude that I'm going to fix this place or that I'm the smartest person or the most helpful person. I walk in there like, what do you need? Which I think is a perfectly reasonable attitude. I don't walk in there with, I have this master plan because I'm the consultant that you're paying this money to. I walk in there with like, I wonder what they need today. I wonder what's going on in the milieu today. I wonder how the staff are doing. I wonder how the nurse is doing. Like, what do they need? What do they need is different than what magical, brilliant thing do I have to offer you because I'm a doctor and I'm a professor and like, that's bullshit.
Well, and the other piece that as you're talking, I'm thinking about the hero cape, because I know for sure I have put on the hero cape doing this work and I know I'm not going to say there's anything wrong with it, but what I will say is it's depleting. And it's not very effective for the client either. Because
that's about you. It's not about them.
Completely. That's what we are addressing in the Institute because anyone can be trained on what to say or how to act in front of a client or the ethics. And those are all important, by the way.
Yes, very.
We're also pointing to something much deeper, and that is the bold statement that I often make. The only thing I really need to do for my client is my own healing. Yeah. Because for me, my role in my family was the hero.
Right.
So I came into this work, even though I was 20-something years sober and thought I was so evolved and ready, I put on the hero cape a lot, and I discovered that it was not effective, and I felt burnt out, and it was really not serving me, nor was it serving the client.
Yeah, one of my favorite things as a clinical supervisor is to talk about that precisely, because the way I phrase it, which is more therapy friendly, is what are my unmet needs, right? So all of us have unmet needs. Every human being walking around on the planet, Ram Dass, if he were here, would have unmet needs. Everybody, right? So every human being has unmet needs. The question that I tell my supervisees to ask themselves is, when I'm talking to this patient about this thing, am I talking to them about it because it's something that matters to them, or because of their transference, to be technical about it, or our counter-transference, or is it because of something that I need that I'm not getting in my real life right now, right? So if I have a financial unmet need, or if I have a safety unmet need, or a physical health unmet need, or a romantic unmet need, whatever it is, right, just to pick some categories, I can easily bring that into my work. It's the easiest thing to do because it's right here for me. It's right here in front of me. And because it's about me, and I'm bringing me into the room to have a relationship with people. But the problem is I'm actually not being present.
That's right.
Right? And that's what you specialize in. You specialize in presence, right? You specialize in where is me showing up here that gets in the way of being present in this relationship with people. And so when I do clinical supervision, I come at it from this other perspective, like counter-transference, so that we talk about what is the unmet thing inside of me that really is showing up in the way that I talk to this person, that keeps me from being present, that keeps me focused on the words and the feelings and not from the experience, right? And that, I think, is what's drastically missing in clinical training. It's missing in being a tech, in being a therapist, a counselor, family therapist, an owner of a treatment center, a program director. It doesn't matter what your role is. We care about our role at the exclusion of being present.
Yes. The other key pain point
Yeah.
is probably the biggest one, and that is clients leaving what we call against medical advice, against clinical advice. In other words, leaving treatment early.
Yeah.
And the biggest issue I have seen, and very well-intended people try to talk people into staying in treatment. And there's nothing wrong with that, except for it doesn't work. Because I'm negotiating with the part of them that wants to leave, and I'm trying to convince them that they should stay. And I hear it over and over and over again, like, have you thought this through? Do you know what's going to happen? You're going to walk out that door.
You're going to die.
You're going to die,
Yep.
right? And like nothing could be maybe truer, but less useful.
Yep.
So when we work with helping a clinician, whether that be a tech, a therapist, a nurse, whoever it is, the person working the front desk, the chef, the housekeeper, because all of us, we're all in the equation.
Yeah.
We're talking about something really different. And again, it's through presence and curiosity. So when I was the spiritual director of a treatment program, I was the person they called in when someone was emotionally dysregulating. In other words, losing their shit, packing their bags, saying, F you, I'm out of here. And I would sit with them, and what I would do when I was walking toward them, two things. What they're upset about is not what they're upset about.
Correct.
Because they're having a massive and explosive reaction. So I know something got touched. I don't know what it is, but I know it's not the phone privilege or the food or why did we not have, whatever that was. But the second thing is I am going to look for the wholeness within them, that place within them that is whole and complete, and my viewing that part of them might help them to access that. Because I have this profound idea. You ready? People don't change unless they want to.
That's crazy.
Crazy idea.
I know.
So how can I help a person get in touch with what they really desire?
Yeah. Yeah, I think just to extend on that just for a second, so-called AMA blocking people leaving against medical advice. When you're talking to someone who wants to go get high, as the easy example, if you're going to talk to them from a practical reality of consequences, that's a conversation for you. That's a conversation for you. That's not a conversation for the patient who wants to get high. Why do they want to get high? For real, why do they want to get high? Do they want to get high because they're running away in shame, like you're talking about? Do they want to get high because they view themselves as incapable, right? Do they want to get high because they don't see themselves as being a part of in this community, in this treatment community, right? Do they want to get high? Do they want to leave because they feel out of control? whatever it is. It doesn't even matter what the specifics are. Most of the time when people do AMA blocking, they're focused on the wrong thing. They're focused on consequences, and they're focused on, some administrative goal, right? Which is to keep you here.
Right.
But the truth of the matter is, to keep you here has nothing to do with what the patient actually needs in that moment, right? What do they actually need? What do they really want? Do they want to get high? Of course they do. But that is just the surface.
That's right.
That is just the surface. And teaching people or providing learning experiences to help people see what is underneath that is not easy. It's just not easy, because we can say on paper, these are the 10 things that might be going through their mind that you should focus on. But also, you have to be able to feel what's going on with the other person. And if you're so fucked up because of your trauma and your shame that you can't even acknowledge the stuff that's going on in the other person, there's no way you can relate to them. There's zero chance.
That's right.
Not 1%, there's zero chance.
And then we guarantee you they will run out the
They
door.
will certainly go.
Yeah, because not only is that part of them who wants to run activated, but we're actually fueling that part of them. So, because we're going to have this institute that's going to take much, much, much deeper dives into all these topics, I don't think we need to even really go much deeper other than to say, for anyone watching, we invite you to go to consciousrecoveryinstitute.com, check out our offerings. We're going to be launching soon.
Soonish.
We have a lot of content to create.
We do,
You and
yeah.
I are going to be sitting in either these chairs or similar chairs for many, many days to create this content. So I'm excited. I'm
Me too.
excited
I think
to
it'd be fun.
co-create with you.
Yeah.
This has been many years coming to fruition, so I'm very grateful.
I'm very grateful as well. I think it's going to be fun, and I think it can actually literally change the industry in a non-grandiose way, like in a very practical, simple way.
I'm going to hold that to be true.
Yeah.
I'm going to hold that as the intention. One of the things I believe very, very deeply is when we create something, if I create with an expectation of it looking a certain way, it doesn't have the same effect as what is the true purpose and meaning. And, for me, the deep, true purpose and meaning is, and I don't mean to be overly verbose here or the truth is there are people dying, and the truth is there are people right now leaving treatment who need the care.
Yeah, no, but for me, it's the other side of that too, which is there are so many hundreds of thousands of healthcare professionals who are also dying.
That's right.
Physicians die by suicide all the time. Therapists, the divorce rates in our profession are out of control. The substance use rates in our profession are out of control. So I hate that my people are suffering.
Yeah.
It's gross. It's gross that we are taught to destroy ourselves to save somebody else's life.
Amen to that.
Because it's not necessary. If it were necessary, I'd be like, absolutely, you chose, like a firefighter. You chose to put yourself in the worst possible scenarios to save someone else's life, and God bless you for doing that.
Right.
Therapy is not firefighting. It's not. But so many people treat it like that, and that's terrible.
No wonder we're burnt out.
Yes.
Well, exciting things coming soon.
I think it's going to be good.
Okay. Thank you so much, Patrick. I love this, and I'm excited to be in this studio creating content in the coming days and weeks.
Me too.
Thank you, everyone. To be continued.